Hello, welcome. Let me ask you some few questions in relation to mathematics. Uh, if you go to hospital and before you see the doctor, you are asked to pass through the OPD. Nurses take your vitals, they take your weight. Be asking yourself, you are coming to see a doctor and they are checking your weight. Let me just hold on to the weight. I know they check your temperature, they check all other things, but let's hold on to the weight. Why do you think they check your weight before you go and see the doctor? So we want to look at how we can prescribe dosage of medicine based on your weight. They are checking your weight because they want to know how they can prescribe the medicines that will be given unto you. Don't forget, medicines are measured in some kind of quantities. That is why if you go, you are asked to take 2 tablets, 1 tablet, take 5 ml or 10 ml. Why? So let's see. We can see that if, for example, your weight is 25 and you are to be administered with 10 milligram of a medicine in a liquid form, how is it going to be administered? Let's take a scenario. All right, so let's see. A medicine is prescribed at 10 milligram per kilogram of a body weight. This means that we needed to give 10 milligram to a body that is weighing 1 kilogram. If your weight that they will check at the OPD is 1 kilogram, then it means that you'll be giving 10 milligram. No, milligram is measuring the mass of the medicine. The mass of the medicine. So if a child which weighs 25 kilogram, what will be the total dose? What will be the amount of mass, the mass of the medicine that will be given to a child who comes into hospital and is weighing 25 kilogram? So this is how doctors make use of your mass before they can prescribe a medicine for you, so that you don't do overdose of the medicine or underdose, right? Good. We can create a proportion from here without thinking too much. We can create a proportion. Beginning with the first concept that we are having 10 milligram per a kilogram, meaning divided by 1 kilogram. That's per kilogram. This is a ratio which is equals to, I am looking for the dose. What dose? The milligram. I'm looking for the milligram. So the milligram can be represented in this case by x, since we like using variable x and y, right? Somebody is asking what is the meaning of finding x and y all the time. These are some of the concepts. We just use the x to represent what we intended to find, right? Okay. Then divided by, this means something milligram per which kilogram of the child. The child is what? 25 kilogram. So this is a ratio corresponding to another ratio. That is a proportion. So we can cross multiply in this case, whereby x times 1 will remain what? X, but in kilogram. And that will be equals to 10 times 25 will be 250. I'm having mg and what? Kg. But I'm looking for x. So I divide by the kg here, meaning x will be equals to 250 ml times kg divided by what? Kg. You see the cancel. So I'll be having 250 milligram. Meaning any time that a child will walk into a hospital and we want to give a medicine to that child based on the weight, not the age, we will ask you for the age also. The age also can be used. The temperature can also be used. But in this concept, we are making use of the weight. So whether you are 15 years and you are weighing 25 kilogram, and if you are to be given a medicine that is 10 milligram per kilo, then it means that you will be giving 250 milligram of that medicine. When I'm talking of milligram, let's take it onto a cake of soap. You know, some soap are big, some are small. If you compare them, the reason why you are looking at the size is based on the amount of material in it. That is a mass of the material. So this is how heavy the medicine will be for that child that weighs what? 25 kilograms. I guess from today, you will appreciate mathematics. Not to say math is not being used anywhere. There is no importance of mathematics to you. But today you will know the reason why your weight is being checked, the reason why you need to stick to calculations of mathematics to prevent underdose and overdose. Like, share, comment, and subscribe.